Lecture 8 in the Principles of Cardiac Sonography 1 unit is entitled Cardiopulmonary Circulation. The contents of the lecture are 1. The great vessels, 2. Features of cardiopulmonary circulation, and 3. Anatomy of the thorax. Learning outcomes. Following this lecture, you will be able to 1. Describe the essential anatomy of the great vessels, 2. Relate key features of cardiovascular circulation, and 3. Describe the essential anatomy of the thorax. The textbook is the Handbook of Cardiac Anatomy, Physiology and Devices, Chapters 1, 4 and 5. Note that not all parts of Chapters 4 and 5 relate to this lecture. The great vessels. The great vessels is a composite term for the large veins and arteries that enter and exit the heart. The great vessels are the superior vena cava and the inferior vena cava, the pulmonary artery, the pulmonary veins, and the aorta. In the first part of this lecture, we will consider aspects of the great arteries, starting with those that allow blood to enter and exit the right heart, then those that allow blood to enter and exit the left heart. The superior vena cava. The superior vena cava, the SVC, is formed via the confluence of the right and left brachiocephalic veins from above and the azygos vein from below and behind. The SVC empties blood into the superior aspect of the right atrium. The SVC can be difficult to image with transthoracic echocardiography. Suprasternal short axis and subcostal short axis views are best for imaging the SVC. These views will be rehearsed in Year 2 of the course. The inferior vena cava. The inferior vena cava, the IVC, passes up through the diaphragm from the abdomen and into the thorax. The IVC empties blood into the inferior right atrium. The eustachian valve guards the orifice of the IVC. The eustachian valve is related to the eustachian ridge, which helps direct blood flow toward the interatrial septum prior to birth. Most often with echo, the IVC is imaged from the subcostal short axis view, where its diameter and respiratory reactivity can be measured. The pulmonary artery. Blood ejected from the right ventricle passes through the pulmonary valve and into the main pulmonary artery. Initially, the main pulmonary artery ascends at an oblique angle to the left and is anterior to the aorta. As it exits the pericardium superiorly, the main pulmonary artery then branches into the right and left pulmonary arteries. The right pulmonary artery branches from the main pulmonary artery and passes under the arch of the aorta. It continues to course rightward and enters the right lung at the hilum, where other structures like the brachial vessels also enter the right lung. The left pulmonary artery branches from the main pulmonary artery and passes anterior to the descending aorta, to which it is connected by the ligamentum arteriosum, that is the remnant ductus arteriosus. The left pulmonary artery courses leftward and enters the left lung at its hilum. the pulmonary veins. 2 pulmonary veins, upper and lower, emerge from each lung. That is, 2 from the right lung and 2 from the left lung. The right upper and lower veins enter the posterior left atrium from the right. The left upper and lower veins enter the posterior left atrium from the left. In adult transthoracic echo, the easiest pulmonary vein to image is the right upper pulmonary vein from the apical four-chamber view. The aorta. Blood ejected from the left ventricle passes through the aortic valve and into the aorta. The ascending aorta, the first part of the aorta, starts at the aortic valve, the most central of the heart valves, and ascends from the pericardium posterior to the pulmonary trunk. The ascending aorta consists of sinus and tubular portions. The sinuses are 3 pouches, 2 of which give rise to the left and right coronary arteries. The tubular portion ascends posterior to the pulmonary artery. The second part of the aorta is its arch. The aortic arch arches posteriorly from right to left at about the level of the sternal angle, before passing over the right pulmonary artery and descending posterior to the left pulmonary artery. At its arch, the aorta gives 3 branches: the right brachiocephalic trunk, the left common carotid, and the left subclavian. The first 2 segments of the aorta, the ascending aorta and its arch, are routinely imaged and measured via echocardiography. And while the first 2 divisions are routinely imaged, the second 2, the descending thoracic aorta and descending abdominal aorta, are less commonly imaged. Nonetheless, learning to image all 4 divisions of the aorta is an important skill. Images of the descending and abdominal aorta will be rehearsed in Year 2 of the course. In the second part of this lecture, we will consider some essential features of cardiopulmonary circulation. Specifically, we will consider blood flow, aspects of cardiopulmonary circulation, and coronary arteries and coronary veins. Blood flow. To support life, blood must flow continuously throughout the body. The driving force for the circulation of blood is the heart. When myocytes within the heart's ventricular walls contract in systole, a sudden and dramatic increase in intraventricular pressure occurs. Left ventricular pressure, for example, increases by about 100 millimeters of mercury in a fraction of a second within systole, and falls equally rapidly when the myocytes relax in diastole. The 4 heart valves open and close in response to pressure changes within the heart. Blood flows forward, antegrade, within the heart due to the synchronous contraction and relaxation of myocytes, and due to the 4 one-way valves within. Once it exits the heart, blood continues to flow antegrade because arterial pressure exceeds venous pressure. Initially, blood flow within the systemic circulation is pulsatile. By the time it reaches the capillaries, its pulsatile flow is no longer present. The table on this slide provides normal adult intracardiac pressure values, along with normal values within the main pulmonary artery and thoracic aorta. Notice that the pressure in the atria are least. The pressures on the left side are greater than the pressures on the right. The pressures vary according to the phase of the cardiac cycle, and pressure within the left ventricle is most variable. Blood flows through blood vessels. Blood vessels have certain features that control flow within them. All blood vessels have a certain length, radius, and they all have an inlet and an outlet. In order for blood to flow, a pressure differential must exist. When the pressure at the inlet and pressure at the outlet are different, blood will flow. For example, if pressure at the inlet is 2 millimeters of mercury and pressure at the outlet 1 millimeter of mercury, blood flows from inlet to outlet. Blood flow is limited by resistance. Resistance is the result of friction between the blood and the blood vessel walls. Flow, Q, is related to the pressure and resistance and is expressed by the equation on this screen. That is, flow equals the pressure difference divided by the resistance. The graph on this slide illustrates that for a given pressure, flow is greater when resistance is low. Blood flow may be limited by disease. For example, plaque in a carotid artery may limit blood flow to the brain. Plaque in a coronary artery may limit blood flow to the heart. Aspects of cardiopulmonary circulation. The cardiovascular system is a closed-loop system. It includes two closed loops, pulmonary and systemic, and they work together to ensure its primary functions are achieved. That is, the pulmonary circulation carries oxygen-poor blood from the heart to the lungs and returns oxygen-rich blood back to the heart. The systemic circulation carries oxygen-rich blood from the heart to the body and returns oxygen-poor blood back to the heart. Both circulate the same volume of blood. Normally, flow in the pulmonary system and flow in the systemic system is 1:1. The heart, the driving force of the circulation, has 4 chambers. 2 upper chambers, the right and left atria, and 2 lower chambers, the right and left ventricles. The anatomical features of the heart support its function. That is, the atria have thin muscular walls to support their primary function as conduits, although they also do have reservoir and pump functions. The ventricles have thick muscular walls, with muscle fibers arranged in different orientations. When they contract, intraventricular pressure increases greatly, forcing blood from the heart. This illustration provides an overview of blood flow within the heart, lungs, and throughout the body. And it is important that you know the passage blood takes throughout the heart, lungs, and the body. 2D imaging and Doppler imaging can be used together to calculate volumetric flow. That is, by measuring the cross-sectional area of the left ventricular outflow tract with 2D and the velocity of flow over a period of time, that is, tracing the VTI measured with pulse wave Doppler, left ventricular stroke volume in milliliters can be calculated. If the stroke volume has been calculated and the heart rate are known, a patient's cardiac output can be calculated. Using the numbers from the figures on this slide, the patient's cardiac output, the product of stroke volume and heart rate, is about 5.4 litres per minute. That is, a normal resting cardiac output. The coronary arteries. The coronary arteries provide the heart with its own supply of blood to meet its significant metabolic needs. There are two main coronary arteries, the right coronary artery and the left coronary artery. The right coronary artery. Its origin, its ostia, is in the right sinus of Valsalva, which is superior to the aortic valve. There are two main branches of the right coronary, the marginal and the posterior endoventricular artery. The right coronary and its branches supply the lateral right side of the heart, including the right atrium, and the posterior right ventricle. The left coronary artery. Its origin. The ostia is in the left sinus of Valsalva, which is superior to the aortic valve. It has two main branches, the left anterior descending and the left circumflex coronary artery. The left coronary arteries and its branches supply the interventricular septum and anterior wall of both ventricles, and the left atrium and posterior left ventricle. Coronary veins. Venous drainage of the heart is accomplished by three systems. 1. The main system, the coronary sinus. Most veins drain back into the coronary sinus. The coronary sinus empties into the inferior right atrium. The os of the coronary sinus, that is, its opening in the right atrium, is protected by the Thespian valve to prevent backflow. Two smaller systems of veins, the anterior cardiac veins that do not drain into the coronary sinus, and the Thespian cardiac veins, which are valveless communications from the myocardial capillaries into all four heart chambers. 3. Anatomy of the thorax. The thorax is the body cavity surrounded by the rib cage. The thorax contains the heart, lungs, and great vessels, as well as other important structures. The thorax is responsible for protecting its contents, the heart and lungs, etc., and for helping to generate negative pressure, because air moves from regions of high to regions of low pressure. Therefore, the passage of air into the lungs works in a similar way to the passage of blood through the cardiovascular system. Compartments of the thorax. The thorax is divided into compartments. Two pulmonary or pleural cavities, a right and left, and the mediastinum, which has superior and inferior parts. The inferior mediastinum is further divided into anterior, middle and posterior. The right and left pleural cavities contain the right and left lungs. The right lung has 3 lobes. It receives blood from the right pulmonary artery, and it empties via the right pulmonary veins. The left lung has 2 lobes. It receives blood from the right pulmonary artery, and it empties via the right pulmonary veins. The primary function of the lungs is to acquire oxygen and to release carbon dioxide. The trachea, which begins at the pharynx, provides a passage for oxygen and carbon dioxide. The trachea travels down into the thorax, where it branches into right and left main bronchi. The right and left bronchi enter the lungs at the hilum. Pleural membranes with parietal and visceral pleura enclose each lung. The thoracic cage. The thoracic skeleton is comprised of the following: thoracic vertebrae posteriorly and intervertebral discs, the sternum, which has the manubrium superiorly, the sternum in the middle, and the xiphoid process inferiorly, the left and right clavicle, and the left and right scapula are also part of the thoracic cage. The image at the top of this slide shows anterior and posterior views of the thoracic cage. As you know well by now, the bones of the thorax obstruct the passage of ultrasound waves. Windows that enable the passage of ultrasound waves to and from the heart must be found. The parasternal, apical, subcostal and suprasternal windows are indicated on the lower image. Muscles unite the bones of the thorax and enable movement for respiration. The diaphragm is the primary muscle of respiration. When relaxed, the diaphragm assumes a dome shape. When the diaphragm contracts, it moves downward, that is, inferiorly, enlarging the thoracic cavity and helping to lower the intrathoracic pressure. The mediastinum. The superior mediastinum is the space behind the manubrium of the sternum. Within the superior mediastinum are the branches of the aorta, the superior vena cava, the vagus and phrenic nerves, and the thymus. The inferior mediastinum has 3 parts: anterior, middle, which importantly houses the heart, and posterior. Surface anatomy. The sternum and costal cartilages are directly anterior to and protect the heart and great vessels. The heart lies at an oblique angle. Its long axis runs along a plane from the right shoulder to the left hip. The base of the heart is at approximately the level of the 3rd ribs, while the apex of the heart is located approximately at the space between the 5th and 6th ribs. Being familiar with surface landmarks will help in the acquisition of echocardiogram images. Knowing, for example, that the apex of the heart is located at approximately the 5th intercostal space on the left side of the thorax will help in locating the apical window. Of course, surface landmarks are a guide, and the best imaging window will not be located at the same position for every patient. In conclusion, the great vessels is a composite term for the superior and inferior vena cava, the pulmonary arteries, pulmonary veins and aorta. The superior and inferior vena cava and pulmonary veins return blood to the heart, whereas the pulmonary arteries and aorta carry blood from the heart. The pulmonary artery and aorta emerge from the base of the heart at an angle. And the aorta, the body's largest artery, has 4 principal divisions. Blood flow is related to changes in pressure, although blood also encounters resistance to flow. The anatomy of the heart's chambers is related to their function. Synchronous contraction and relaxation of the heart, plus functional motion of valves, helps to ensure the forward flow of blood. The heart requires its own blood to meet its considerable metabolic needs. Blood supply to the heart is via the coronary arteries. The thoracic cage protects the organs of the thorax and helps to generate negative pressure. The thorax is divided into compartments. The anatomy of the thorax, and especially the sternum, dictates where echocardiographic images can be acquired from.